For more on this and some of the other health headlines discussed, I'm joined by Dr. Peter Hoetz. He is the co-director of the Texas Children's Hospital Center for Vaccine Development. He's also the dean of the National School of Tropical Medicine at Baylor College of Medicine. Doctor, great to have you on as always. Let's start with Paxlovid. This new report, the FDA seems to like it. It's a good thing. What's your takeaway?
Well, I think it's especially important to use this medicine for seniors. We're seeing too many seniors who get COVID either as breakthrough, even if they've been vaccinated, or who've non-vaccinated and gotten infected, not take advantage of the availability of Paxlovid and tragically become hospitalized or sometimes even lose their lives. And we know if they go on Paxlovid, that can be a lifesaver. So we're not getting the word out sufficiently, especially to older Americans or even their internists, about the importance of getting it. The issue around rebound is an interesting one. Anecdotally, we're hearing about a number of cases, and Dr. Fauci had rebound after Paxlovid. And by the way, I had rebound after breakthrough COVID as well with Paxlovid. But that's what they are. They're anecdotes, and the data really supports that rebound occurs at very low levels. And so all signs point to the importance of this medicine, and it is a lifesaver, especially among seniors and those with underlying severe health conditions.
Other than seniors and those who may be at greater risk, who else would be a good candidate for this if the FDA does grant approval?
Well, I think the others are the immunocompromised. That would certainly be something. And then even if you're not in any of those categories, you still want to have a conversation with your internist. Here's why it's important. I think what happens sometimes is people feel, hey, this is a pretty mild case, I'm just going to write it out. But then when things go bad, they go bad pretty quickly. And number one, and number two, this medicine works by inhibiting the replication of the virus. So that means it only works in the early phases of COVID. Once you progress in your illness and you start having an inflammatory response, then the effectiveness of the medicine goes way down. So the point is, if you're going to take the medicine, you have to make an executive decision pretty early on whether it's up or down, and that's really important. So have that conversation with your internist.
Do you expect, doctor, that the FDA will grant full approval? And if that happens, is this something that will need to be prescribed, or would it be over the counter like many of the COVID tests that we now get?
Well, I think all signs point to that it should be approved. It's a safe medication. It works incredibly well. Exactly what the prescribing mechanism is going to be, because remember, if you remember, the Biden administration talked about a test and treat option with your pharmacist, and whether that will require a full-on bona fide prescription, particularly now that COVID cases are going down, or whether they'll allow the pharmacist some leeway to move forward, I think that's an unknown question.
One of the other things that stands out is COVID-19 vaccine patents have become an issue as of late, keeping millions of people around the world from getting some of the life-saving shots that they need. Can you talk a little bit about more your patent-free COVID vaccine program and what's that doing?
Yeah, what happened was we saw that the mRNA vaccines were coming too little too late, especially in low and middle income countries, and India was getting slammed in Indonesia. So what we did, we developed a recombinant protein COVID vaccine, which uses an older technology, the same technology used to make the recombinant hepatitis B vaccine that's been around for a couple of decades. But it seems to work as well as the mRNA vaccines, and we decided to do this with no patent and to simplify things and try to minimize the red tape, and then licensed it so far to vaccine producers in India, in Indonesia, Bangladesh, and one working with Botswana. And now in India and Indonesia, those two vaccines, one known as Corbevax, produced by Biological E, and the other one Indavac, produced by Biopharma, almost 100 million doses have been administered. So I think we provide a proof of concept. You don't have to be a big multinational pharma company to still do big things. So that's very exciting to make that contribution. And I think it's a way forward. It's not that we want to demonize the pharma companies either. They do important things, but the point is to broaden that ecosystem and not rely exclusively on the big pharma companies, and finding alternative ways, such as organizations such as our Texas Children's Hospital Center for Vaccine Development at Baylor College of Medicine, and working with low and middle income country vaccine producers.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.